bone density.
You and I both. Thank you,
Yeah.
Agnes. Well, you might know what your blood pressure is or where your cholesterol levels are, but do you know your bone density score? We may not think about it very often, but having strong bones can be as important to your overall health as preventing things like heart attack and stroke. Dr. Donald Thigpen with the Bone Density Center joins us this morning to tell us why we all need to know where we stand. And it's something we don't really think about till we start creeping up in years, but it's something we need to think about early on.
Absolutely. What a lot of people don't realize is osteoporosis or bone loss is a silent disease. You can't feel your bones weakening. You can't feel the density of your bones getting less and less as you age. Usually the first symptom of osteoporosis or bone loss is a fracture, and by that time it's a little too late, or at least you're going to have to put some work in to recover from that. So it's good to start now. Find out your bone density score now, especially if you're over the age of 35, and start preventing that so that your first symptom is not a fracture, but instead we can start building that bone density now, preventing that bone loss.
And I didn't realize 35 sounds very young to me.
It does.
A lot of 35-year-olds are not thinking about their bone density, but that's when you actually start losing the density of your bones.
Absolutely. As early as 35, you can start losing bone mass, and statistics show that by the time women are 50 years old, 50% of women are going to experience a fracture due to bone loss or osteoporosis.
And you told us a very startling fact to me that many people, especially the elderly, if they get a hip fracture, many of them die within a year of that.
Absolutely. A hip fracture can be fatal. So, healthy bones, strong bones can be a life-saving regimen for you. But yeah, seniors that break a bone can die within a year. In fact, 20 to 25% of seniors that break a hip die within a year of that incident.
That's really startling. Do we need to ask our general practitioner then to schedule us for a bone density screening, or is it something that we can do on our own?
You can come in on your own to the Bone Density Center. You don't need a referral. You can come directly in. We can sit you down, schedule your appointment. Once your bone scan is done, we can take your results, interpret those results for you, and actually recommend the highest quality supplements on the market today. A lot of times the supplements that you get at your local retail store can be of a lesser quality. The absorption of the calcium, you may be taking a dozen calcium pills a day and only absorbing 25 or 30% of it. If you get a higher quality supplement of calcium and vitamin D, you may absorb twice as much.
And that's another component too. If you're just taking calcium thinking that you're doing something good for your bones, that may not be enough because you have to have the D3 component. Or the
absolutely. You have to have vitamin D in association with the calcium. And there's other factors that can play, as far as bone density. Thyroid function can play a role. The amount of vitamin D that's actually in the blood can play a role. So there may be some further steps that we have to take to find the right regimen for you. But most people, we can just put you on a high-quality calcium, vitamin D supplement, and we can get that bone density back up.
And exercise is another part of that puzzle.
Exercise is very important. Not only do we recommend the proper supplements for you, we make lifestyle recommendations, dietary recommendations, and exercise recommendations.
All right, and we want to make sure that we are talking to the men as well as the women, because a lot of people think, I'm pretty much the poster child, I think, for bone density issues if you're slight, if you're white, if you're female.
Absolutely.
But it happens to men as well.
Absolutely. Most men don't think about it, but 1 in 4 men will also experience a fracture due to osteoporosis or bone loss.
All right. Well, you can give the Bone Density Center a call at the number that you see on the screen and find out where you stand. Thanks for coming in today. Good to talk to you. Well, up next, we're going to be talking about impressions of nature. We're going to show you after the break.